Good afternoon, everybody. Welcome to Amity University. Amity is a research and innovation-driven university following the ideals and the principles and the sanskars laid down by our Honorable Founder President, Dr. Ashok K. Chauhan sir, and our visionary leader, the dynamic Chancellor, our very Honorable Dr. Atul Chauhan sir. We are also led by our very dynamic and visionary academic leader, Professor Dr. Balwinder Shukla ma'am, who's the Honorable Vice Chancellor. So this is the third webinar in the series of the webinars on the Transgenders Act of 2019 and the Rules 2020. This is a project that we have got from the Ministry of Social Justice and Empowerment. I'm Sumitra, your host for the day, and with me is Dr. Varuna Chakravarti. She is the co-moderator. So today, this topic on Transgenders Act of 2019 is going to talk about the health rights within the ambit of the Transgenders Act of 2019. What kind of health rights do the transgenders assume accrue, get from the Act of 2019? So up the panel today, we have with us our guest speaker, Advocate Iftikhar Bazmi, who is the chairman of Faith-Based Reconciliation Trust. He is joining us right from Jammu and Kashmir. Thank you, sir. We have with us Dr. Khushbu Malik, who is assistant professor at Amity Law School, Noida. We have with us Dr. Harshita Singh, who is assistant professor at Amity Law School, Noida. And joining us shortly will be Mr. Sachin Kalra, who is the vice president and deputy general counsel at HT Media Limited. So I welcome all the panelists today, and with me is the co-convener of this webinar series, Dr. Nitin Sharma. So welcome everybody to this webinar series, and today is the third webinar in the series of the webinars. And as we begin this webinar, it becomes very impertinent for me to talk about the 2014 NALSA, the NALSA Act. In 2014, the Supreme Court of India, there was a case, between the National Legal Services Authority versus Union of India, which established the foundation of the rights of the transgender persons in India by recognizing transgenders as the third gender. And this is one of the ways in which Amity Legal Aid and Literacy Committee is trying to do its bit for the society by trying to spread the awareness regarding Transgenders Act of 2019 and 2020. We are thankful to the Ministry of Social Justice and Empowerment, who has shown immense faith in us. So without any further ado, I welcome everybody to this webinar. And to begin with the webinar, let's invoke the blessings of the goddess, and I'll request Vijay to play the Saraswati Vandana video. I'll request everybody to join us in invoking the goddess.
Om Bhurvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Naha Prachodayat Dhiyo Yo Naha Prachodayat. He Sharide Ma, He Sharide Ma, Ajnanita se hame tar de Ma. He Sharide Ma, He Sharide Ma, Ajnanita se hame tar de Ma. To श्वेत वर्णी कमल पे विराजे, हाथों में वीणा मुकुट सर पे साजे. तो श्वेत वर्णी कमल पे विराजे, हाथों में वीणा मुकुट सर पे साजे. मन से हमारे मिटा दे अंधेरे, हमको जालो का संसार दे माँ. हे शारदे माँ, हे शारदे माँ, अज्ञानता से हमें तार दे माँ. अज्ञानता से हमें तार दे माँ. अज्ञानता से हमें तार दे माँ.
That's beautiful. And as we invoke our physical, causal beings with the light that the goddess emanates from her, let us all fill ourselves with so much of pure feelings and the knowledge that transcends all the barriers. Ladies and gentlemen, boys and girls, welcome to the third webinar in the series of webinar on Transgenders Act of 2019 and the Rules 2020. Much has been talked about in the first webinar and the second one, and to talk more about how and what has been the genesis of this webinar series, I would request the co-convener of this webinar series, Dr. Nitin Sharma sir, to present the introductory remarks. Over to you, sir.
Thank you so much, ma'am. So hopefully I'm audible.
Yes, Vijay.
Yes.
That is audible.
So thank you so much, ma'am, for providing us the brief description about the today's discussion. So at the outset, first of all, I am extremely thankful to the Ministry of Social Justice and Empowerment for choosing us in disseminating this important piece of information, which was being deliberated by the judiciary and which was already within the contours of the Indian Constitution, that we the people of India, it includes everyone, be it like male, female, or we can say the third gender. So, keeping in view the international human rights commitments and as well as the constitutional commitments, we, as a part of the Legal Aid Committee, we are observing this particular webinar series, and today we are observing the webinar series session third, and the title is Health Rights. So, by way of this webinar series, we have like decided to, and we have made each and every attempt possible to touch each and every aspect of the issues confronting the transgender community in India, be it like the issue of inclusive education, be it health rights, be it like the grievance redressal mechanism, be it like the national council for the transgender person. Similarly, what proper can be done, or what are the possible solutions that can be uh, made or that can be suggested to the concerned ministries, since Ministry of Social Justice and Empowerment is the nodal ministry for the implementation of this particular legislation. So by way of these deliberations, we will be able to suggest the concerned ministry that many possible amendments can be made, and at the same time, through by deliberating upon these issues by the concerned esteemed speakers. Today we are having with us four esteemed speakers, and they have their own perspectives and on way of looking at the things from different ways. So we hope that on today's topic, we are going to listen and number of different perspectives, and at the same time, it will be of immense help to the transgender community in India. I think in the previous past, they have not got due attention, and it is our duty as being a citizen of India to accord dignity, to promote the values of universal human dignity, universal equality, freedom, and the values of peace and sustainability rather. So the peace and just and inclusive societies can only be there if we are going to give equal justice to everybody, and this is possible only when we all as a group and as a member of our society will be able to accord due dignity to all the people. Thank you so much. Thank you so much, ma'am. And once again, welcome to all the esteemed guests. Thank you, ma'am.
Thank you, Dr. Nitin Sharma, and together, both of us have been into this journey of bringing this project to Amity Legal Aid and Literacy Committee. I remember the days back when we were visiting the ministry and talking about the great work that we've been doing from the ambit of Amity Legal Aid and Literacy Committee. The people from the ministry were very happy that Amity Legal Aid and Literacy Committee is coming up with issues like for the welfare of the Transgenders Act 2019. Well, everybody, uh, it's important for us to understand that the Act of 2019 for the transgenders, it talks about a provision that provides the transgenders the right of residence with the parents and also with the immediate family members. The Act prohibits discrimination against a transgender person in various sectors such as education, employment, and also healthcare. And that is the topic that we are taking up for the third webinar. Well, with this, I remember this very famous quotation expression. So, denial of self expression is something that almost all of us across the globe will not appreciate. And of course, it is said that the denial of self expression is inviting death, and irreplaceability of individuality and identity is grant of respect to the self. Why not all of us live with a dignified self? Honor yourself. This and much more will now be deliberated by our dear friend and advocate in Jammu and Kashmir, uh, Mr. Iftikhar Wazmi, who has been an advisor also to Amity Legal Aid and Literacy Committee since a long time now. Sir is joining us from a very sensitive area in Jammu and Kashmir, and he's also the chairman of faith-based um, Reconciliation Trust, which does a lot of social welfare work, especially in the border areas. And also, sir has traveled extensively across the globe. So I will now request, without any further ado, Mr. Iftikhar Basmi to present his address on the Transgenders Act of 2019 within the ambit of health rights. Over to you, Iftikhar Basmi. Basmi, sir, can you hear me? Basmi, sir, can you turn on your camera, please, so that we can see you and hear you? Basmi, sir? As I said, that sir is joining us from a very sensitive area and also from the states of Jammu and Kashmir. Let us await his presence. Yeah, we are trying to contact him. Yeah, over to you, Basmi, sir, if you can see me and hear me.
Yes, I can hear you. There were some internet issues, so I was disconnected.
No problem, sir. Over to you, sir. The stage is all yours.
Sir, I welcome everyone who is there on the Zoom at the moment. So today's topic is transgender and Transgender Act 2019. Myself, as Sumitra has already introduced me, and Dr. Nitin is also there. And there are so many other panelists and participants also there. This is a very important issue which is going to be discussed today. Since this transgender, they are equally, having the same respect as the other people, like the males and the females who are there in the world they are having. So this act was actually formulated and enacted 5th of December 2019 by the Parliament of India for the welfare and for the protection of the transgenders. और मैं सबसे बड़ी बात ये बताना चाहूंगा कि आज जिस विषय के ऊपर हम बात कर रहे हैं, अगर हम देखेंगे आज की डेट में देखेंगे, कहीं पे भी अगर हम जाते हैं, बसेस में जाते हैं, ट्रेन्स में जाते हैं, इवन एयरपोर्ट्स पे जाते हैं, कहीं ना कहीं हम लोग ट्रांसजेंडर्स की रिस्पेक्ट जरूर करते हैं, हम उनसे ब्लेसिंग्स लेते हैं, हम उनको पैसे देते हैं, लेकिन वो हम अपने मतलब के लिए लेते हैं कि हमें ब्लेसिंग्स चाहिए। लेकिन जब उनको ब्लेसिंग देने की बारी आती है, जब उनके लिए हम ये चाहते हैं कि हम उनके साथ भी अच्छा व्यवहार करें और इक्वल जो उनके साथ ट्रीटमेंट होना चाहिए, वहाँ पर कहीं ना कहीं हम लैग करते हैं। और मैं आपको ये बताना चाहूंगा कि अगर हम कहीं पे भी ट्रांसजेंडर्स में से कोई भी ट्रांसजेंडर्स में से, जैसे हमारे पार्टिसिपेंट्स भी हैं, पैनलिस्ट भी हैं, ट्रांसजेंडर्स की जो अगर कोई डेफिनेशन देखेंगे तो एक फिक्स डेफिनेशन नहीं है। ट्रांसजेंडर्स में से हमारे मेल्स भी आते हैं और फीमेल्स भी आते हैं, और कहीं ना कहीं हम अगर हमारी फैमिलीज में से कोई ट्रांसजेंडर में आते हैं तो हम इसको एक सोशल स्टिग्मा समझते हैं कि हमारे घरों में जो है एक ट्रांसजेंडर जो है पैदा हुआ है, लेकिन ऐसा तो है नहीं है। लेकिन आप देखे होंगे कि हमने रिसेंटली जो है आहिस्ता आहिस्ता हमने इस चीज को रिकॉग्नाइज करना शुरू कर दिया है, इनकी रिकॉग्निशन होना शुरू हो गई है, और इवन इंडिया में तो अब रिजर्वेशंस भी हो गई हैं। अगर आप देखें लास्ट टाइम जो IAS IPS ऑफिसर्स हमारे हैं, इस लेवल के ऊपर भी आप देखेंगे कमिंग ईयर्स में जो है ट्रांसजेंडर्स में से भी हमारे पास आएंगे। और हम चाहते हैं कि आज का जो हमारा जूम है, इसमें हम लोगों को इस विषय से हम बताना चाहते हैं कि जितना भी जल्दी हो सके हम ट्रांसजेंडर्स की अपलिफ्टमेंट के लिए, उनकी सोशल सिक्योरिटी के लिए जितना भी हम एनेक्टमेंट कर सकते हैं हमें करना चाहिए। और सबसे बड़ी बात ये है कि हम अभी जो है बहुत पीछे हैं, और जितना भी हम चाहें तो हम जितना हमें डिलीवर करना चाहिए ट्रांसजेंडर्स के लिए हम कर नहीं पा रहे हैं। मेरी कोशिश तो आज ये भी थी कि हम जितना जल्दी हो सके तो हम इनको आगे लाएं। और मेरी कोशिश थी कि आज हमारे मेरे एरिया में जो ट्रांसजेंडर्स हैं, मैंने कोशिश की थी कि अगर मैं जूम पे उनको भी सामने ला सकूं, लेकिन आई वाज नॉट एबल एंड सक्सीडेड इन गेटिंग देम ऑन द जूम, बट नेक्स्ट टाइम आई विल डेफिनेटली ट्राई दैट आई विल ब्रिंग देम ऑन द कैमरा, दैट the people, they can also listen them, they can hear them, what actually their demands, what is their demands, and how they are equally responsible for society as we people are. तो इन चीजों का विषय जो है एक बहुत बड़ा है, और हमें चाहिए कि जिस तरीके से सोसाइटी हम बाकी लोगों को रिस्पेक्ट देते हैं, तो उसी तरीके से हमें आज भी जो है ट्रांसजेंडर्स को जो है रिस्पेक्ट देना चाहिए। और जिस चीज के लिए, जिस विषय के लिए ये एक्ट जो है बनाया गया था 2019 में, तो आज 4 साल होने के बावजूद भी अगर हम देखेंगे तो उतना डिलीवरी ऑफ जस्टिस जो है ट्रांसजेंडर्स के साथ नहीं हुआ। हमें ओपन में उनकी सपोर्ट्स में आना चाहिए। कहीं पे अगर कोई ऐसी परेशानी या कोई प्रॉब्लम होती है तो हमें उन लोगों का
So as Basmi sir was telling that he wanted to bring two transgender persons here on the screen, we had welcomed this idea because these are the people for whom Basmi sir has actually worked with and worked for. So as he was working with them, which he had shared with us previously, you have to build that rapport and trust with the people. So they could repose that trust in Mr. Basmi, and which is why they could express everything with him. So we are just awaiting his presence. Sir, can you just check if he is here? As we are streaming live on YouTube, this is to inform everybody who's watching us live that this is the third webinar in the series of 10 webinars that we are going to organize on Transgender Persons Act of 2019 and the Rules 2020. And this is a project that we've got from Ministry of Social Justice and Empowerment for Amity Legal Aid and Literacy Committee at Amity Law School, Noida, Amity University, Uttar Pradesh. Well, everybody, at Amity University, we follow the ideals of our founder president, Dr. Ashok K. Chauhan, who has motivated Amity Legal Aid and Literacy Committee to come up with measures that can help the society in every way that we can. So awaiting now the presence of Mr. Basmi once again. Yeah, sir, Professor Dr. Aditya Tomar, sir, our additional director is here. Sir, in the meanwhile, when Basmi sir is joining, can you please speak a few words to the audience, sir?
Thank you, Dr. Sumit. Audible, though I am not able to see to myself properly. My picture is fluctuating. So just I just like to take the pride, privilege, and opportunity to welcome our guest, Advocate Iftikhar Ahmed Basmi Sahab, Mr. Chandrasekhar Singh, HR professional and founder, Possibility Consulting Private Limited Ji, Mr. Sachin Kalra Sahab, Vice President and Deputy General Counsel, ST Media, and our dear colleague, Dr. Khushbu Malik. In addition, I like to appreciate the presence and the contribution made by Ms. Varuna Chakravarti, the program coordinators, Dr. Sumitra Singh and Dr. Nitin Sharma, who just take the initiative to bring this opportunity, funded opportunity, sponsored opportunity from the side of Ministry of Social Justice and Empowerment. So I think these deliberations with the speakers from different backgrounds, as Dr. Khushbu Malik is representing to the academicians, to the HR professional industry and the advocate. So this discussion will lead a fruitful outcome at the end of the webinar, and the student would enjoy the deliberations made by our learner speakers. So with these words, I would like to thanks to all the speakers to spare their valuable time, and congratulate to all the students who are getting the opportunity to listen the learned speakers. Thank you. Thank you very much.
Thank you so much, Professor Dr. Aditya Tomar, sir, Additional Director and Joint HOI, Amity Law School, Noida. Sir, it's with your motivation and blessings that Amity Legal Aid and Literacy Committee is trying to do its maximum contribution for the society. Thank you so much for your blessings always. Well, ladies and gentlemen, when we talk about the Transgender Persons Act of 2019, we should understand what the act actually is. In a nutshell, this act states that a transgender person shall have the right to self-perceived gender identity. So a certificate of identity can be obtained at the district magistrate's office, and a revised certificate can be obtained if the sex is changed. However, now this act states that the offenses against the Transgender Persons Act will attract imprisonment between 6 months and 2 years, in addition to a fine as well. So because Basbi sir is having some technical glitch, as I already said that he's joining us from a very remote and sensitive area, I will now hand over the dais to co-moderator Dr. Varuna Chakrabarti to take over. Dr. Varuna.
Good afternoon, ma'am. Good afternoon, everyone present here. So I would like to take this opportunity to invite our next speaker, who is Dr. Harshita Singh, our very own Dr. Harshita Singh. She is a product of DAV College. She did her master's from CCS University and PhD from Naval University. She has an academic experience of over a decade. Without wasting further time, let's welcome ma'am. Ma'am, kindly bless us with your insightful words.
A very good afternoon to one and all. I am very much thankful to our joint HOI Professor Dr. Aditya Tomar sir and the coordinators of this event, Dr. Sumitra Singh and Dr. Nitant sir, who gave me this opportunity. Although I'm not very much well prepared on this topic, but I really would like to, you can say, share some of my ideas related to this, as this topic is really gives us the new aspects and the ideologies of the recent world, where we can actually means, you can say, we can actually define the equality in different perspective. Okay, so let me start with this particular word, which is, you can say, a kind of a social stigma in our country, that is transgender. And transgender means a person whose gender does not match with the gender assigned to that person at birth. It includes trans person with intersex variations, gender queer, and person having socio-cultural identities, which is commonly known as by the name of the Kinnar, or in some places they are known as by the name of the Jokta, Arvanis, and so many other names has been given to these people. As far as concern to the issues that faced by the transgender, specifically related to the health, so I can say that they are subject to the violence. They are subject to they face so many mental health issues, and they are not very well treated by the doctors and the people who can actually take care of them. So sometimes they are subjected to custodial violence. Sometimes the services shall be denied by the experienced people to them. Okay, sometimes by the doctors, or you can say the other people who can actually take care of their health, they denied to provide their services to them because of the social stigma which has been, you can say, inculcated in our country since long. Not only in our country, but sometimes in other, you can say, part of the world, we can say that these people usually being treated as the as different from the normal, different from the societies. They are not considered as a part of the society. So that's this particular thing sometimes affect their health, their mental health, I must say, in a very specific way, due to which they are being subjected to so many diseases. and so many psychological diseases they face due to these type of you can say the behavior of the people, the behavior of the well-educated people, I must say. Apart from that, I can say when we talk about the issues which shall be faced by the transgenders, like they experience high rates of unemployment, housing insecurity, marginalization, educational problem. In many of the educational institutions, they are not being, you can say, given admissions. Okay, so these are the phases or the challenges which shall be faced by the transgender people, even in the era of the 21st century. Sometimes they are forced for gender confirmation and also face physical and verbal abuse, which affects their mental, or you can say the psychological health. As far as concerned to the health issues, their exposure to basic health care is minimal, as they are subject to apathy from medical fraternity, with professionals lacking of transgender healthcare competency. Uh, because of gender minority stress, transgender people may be at higher risk of emotional and psychological abuse, physical and sexual violence, sexually transmitted infections, mental health problems such as depression, and so on. When we let's talk about the certain, you can say, transgender patients they are affecting from the heightened level of violence and abuse that transgender people experience, result in unique adverse effects on bodily and mental health. Studies in countries of the global north shows higher levels of discrimination and harassment in school, in workplace, at healthcare services, and the family when compared with the when they compared with the transgender population, situating transphobia as a key health risk factor for the physical and mental health of transgender people. Let's talk about the mental health, specifically about the mental health. So those who are transgenders are, you can say, significantly more likely to be dispersed with anxiety disorders or depression than the general population, as per studies. Mental health problem among trans people are related to higher rates of self-harm, drugs usage, suicidal attempts, or you can say as per the sympathetic review, as per the systematic review or the study review, we can say that there are certain researchers who conducted the studies on the transgenders, and specifically when we talk about the James Cook University, certain evidences has been reported by this university, and they reported that 75.3% of the respondents have negative experience during physician visit when seeking gender identity based care. So this is one of the major problem, not only in our country but at worldwide. And when we talk about the global access to transgender healthcare, so I can say that global access to healthcare across primary and secondary health settings remains fragmental for transgenders, with access and services highly dependent on political administration, support for trans health in policy. In a landmark case or in a landmark ruling of the Supreme Court in National Legal Services Authority versus Union of India 2014, it was recognized. These transgenders were recognized as a third gender. Okay, and Honorable Justice K.S. Radhakrishnan observed that the recognition of transgender as a third gender is not a social or medical issue, but a human right issue. So they clearly mention it. Okay, I mean, because there is a social stigma in our country, there are certain social, you can say, certain socially unacceptableness about these transgenders. So due to this reason only, their psychological, or you can say their mental health get affected. I must say, if I really would like to add something more. In order to access healthcare, some trans people may create the legitimate narratives of the medical models expressing expressing a desire to live as the other gender since childhood, and feeling of rejection towards their genitalia and being heterosexuals. Sometimes these transgender peoples are forced by their family members to change their, you can say, to change their transgender identity. That also creates a bad effect on their mental health, sometimes their physical health. And data in our country reported that most of the transgender people, you can say children, may get died because of these type of operations they are forced to be in. Some studies approaches depathologization as the potential scope for legitimating the rights for individuals to have autonomy over their bodies and identities, creating visible bodies and spaces and places of resistance, assuming that this premise entails not only problematizing the models, but also human lives themselves. I don't have too much to say on this topic because this is all what I can say about that. Of course, even in this era, we all are educated. We all know the meaning of the equality. We all know about the rights of education and all that. And even we are very much educated people who are not ready to accept the transgenders. We still treat them not as a part of our society, but we are somehow treat them as a separate society. And till we are not able to, till the people like us, like the educated people like us, if we are not ready to accept them, nothing will be going to change. There are lots of acts, there are lots of rules, there are lots of regulations. They all are talking about their health, about their stigmas, about their rights. But I think we are the first person who are ready. If we are ready to accept them, then of course we need not require these specific laws for the transgender. I personally feel that why separate laws for these people? Why separate medical facilities? Why separate, you can say, rules and regulations? Why we required all these things? They are the human beings like us. So if being a female or being a male, I can go to a psychiatrist or I can go to a physician. Why not these transgender people? There are certain, these are the questions which is in front of us, not in front of the society, but we are the first person this question creates in front of us, and we need to find out the solution. Being an individual, I need to find out the solution. And the day we are ready to accept the transgenders, we actually need not these specific rules, regulations, laws, bylaws, orders, or you can say the clinical facilities or specific doctors and all that. As a worldwide problem of transgenders, in last, I would like to say that some studies contributed to the social stigmatization of the transgender people by locating the problem in transsexual and not questioning transphobic. Therefore, negative referential framework of intervention but produce that instead of accompanying individuals in making decisions about their identities, served as the gatekeepers of the gender system. That's all. And thank you so very much.
Thank you so much, ma'am, for such an insightful session. Moving on to next. So when we see a list of all great men in the world, we find that most of them were advocates like Mahatma Gandhi, Pandit Jawaharlal Nehru. And we are glad that today's speaker, the guest speaker for this session, is also an advocate practicing, who is a standing counsel of Jammu and Kashmir. So I do not want to come in between you and your speaker, but quickly hand over the platform. Sir, the platform is open for you.
Thank you, ma'am. It was a very, nice deliberation by Dr. Harshita. And so I was listening because since, everyone knows that in Jammu and Kashmir, where the area where from I belongs is a Poonch area. And so we do have a internet problem here. So it is disconnecting many times. And I was, sometimes we are stuck in a traffic jam. I was just like stuck in this internet problem. So I think this would not come in between us. So as Dr. Harshita has, rightly said about the all things, the stigmatizations, the problem faced by the transgenders, what are their right and what are their duties. If we see in the coming days, we will be having an election in different part of the India. And so when they have a right to vote, why they don't have a right to contest? So there should be one thing. So it should not be a transgender is contesting and transgenders are going to vote. No, the transgenders has to contest, and each and everyone has to cast a vote irrespective of the status of the candidate. One thing. The other thing is that at one point, if we see, we have a sympathy for the transgenders. When I have already discussed, when we have, self, motivated things, something which we think is for us. So, it is also a stigma that if sometimes some transgenders come to your house, initially we don't allow them to come inside, but if somehow they try to come and they succeeded come inside, we don't give them a proper respect. But those who know they are a same persons from the society where from we belong, they do give them respect, they do give them equality in their family, they do offer them a tea, they do offer them a everything which they are offering to any other person. But it is not at all which lasts forever. Somehow the people who are having some superstition that if we're not having a good connections with the transgender, maybe this will be a curse for us, maybe the god will punish us. It is not like that. They are a human being like us. If this time Mr. Bazmi is just in front of you all, if I would have been a transgender, should you not ask me to come on the Zoom? Why not? Yes, because it should have been a platform for the transgenders also, so that they may also interact with we people also. But we just discuss without considering them, without considering their feelings. It will be a better in the next time when we'll having a Zoom on the transgenders, we must ask some of the transgenders to participate, to just express their feelings, so that we may know what actually they are feeling. Yesterday, I have an opportunity to meet 3 transgenders. They are in the Punch, and they were, if they have a problem, they definitely come to the court and they ask me to help them in different fields. And I'm an eyewitness to them that the police and the civilians, they have harassed them many times. They were taken to the custody by the police, and I was there in the police station just to ask them, they are not the victim, they are not the accused persons, you have victimized them. And yesterday they were telling me that after your intervention, the police is not harassing us now. We are living as a, as a human being, as a normal human being, and they people are not harassing us, because it is our moral duty, it is our social duty to give them a proper respect. We have also seen that when we people are not giving them a proper respect, and if the transgender is from our family and they live in an isolation, then the things go worst. They start taking drugs, they start living in isolation, they are being isolated from the rest part of the society, then they start taking drugs, they are going to the worst conditions. And ultimately, if we are not coming for their rescue, and I have seen many of the transgenders, they have committed suicides. Why? Because people are not accepting them, the society not accepting them. Why? Because we people are responsible for them. It is not them to be responsible, because we people are not ready to accept them in the society. On the Zoom, on the webinar, on the stage, we do consider that they are equally having a rights and the duties as we have, but we are not giving them. If I would have been a legislator, maybe I would have not been given them a responsibility like I am having, because I want to go far away, and I have to take that position which the others can't do. I will never allow anyone to come just in my way. So this is what we people are thinking. But if I really, really want to do something for a transgenders, then we have to raise this alarm in the legislations, in the parliaments, so that they may be given the proper time. And as far as I have a suggestion, because so many people, they are on the webinar, they are on the Zoom, and this is being shared on the YouTube. Those people, we have a social security for different people. Old age pension is there. We have a a pension scheme for the disabled person. Why should not we have this financial assistance for the transgenders directly? They should be given irrespective of whether they are doing some work or not. They should be given the financial assistance, so that they should be equally at par with the other civilians also, and those who are living in the society. The people, they must raise slogans, they must raise this alarm that these transgenders are equally responsible as we are. They are equally having the rights and the duties as we have. But in reality, we people are not ready to do this. But if we really want to be a good citizen of India, you might see behind me is Mahatma Gandhi and the father of Constitution. What they have given us, should be equally distributed amongst the transgenders. If the Constitution is for everyone, this is for the transgenders also. The transgenders should be given equal respects, whether it is a male, it is a female. But we have to accept them. We should be ask them to sit with us on the chair. We should also offer them a cup of tea. Then they should be taken away from the, this stigmatization, from the isolation, from the other things which takes the people's life, and they are ultimately very much distrust to commit suicide. So this should be raised by those peers, those students, those social workers who really wants to do. I have seen a lot of transgenders in the America, in the UK. Even I met with so many transgenders in Thailand and Malaysia, and they were narrating their stories. And if when you listen their stories, the tears are coming out of your eyes. You will see these people are like us, but why we people are not giving them respect? You have seen these transgenders, they are residing in slum areas. They have been given a small places, just nearer to the bridges, nearer to the areas which are meant for putting the dust and debris there. Why are they not the equally having the status of other people who are in the societies? But government has to take the initiative. They are making the rules. They have enacted a law for them. But are we really giving them a justice? The question is, are we really giving them a justice? The answer will be definitely no, because this is only in the books. This is only in the acts, not in reality. So by way of today's webinar, we should be determined just to raise this slogan for the welfare, for the benefit of the transgenders. This is today's message to the world on behalf of the transgenders. Thank you, ma'am.
Thank you so much, sir. I appreciate the session being so educational. I'm confident that a large portion of what we learned in this session will be retained by our learners. As sir rightly pointed out, that we humans have the nature of being selfish. This selfishness and untouchability has left the transgenders vulnerable. When India has celebrated 70 years of Azadi Ka Amrit Mahotsav, yet somewhere lies arbitrariness in practicing equality amongst all in society, irrespective of gender. With this note, I'd like to invite our next speaker, who is Dr. Khushbu Malik. She is a product of MDB Rohtak. She did her master's from Guru Govind Indraprasth University and PhD from Faculty of Law. Ma'am, the platform is all yours.
Am I audible? Thank you, Varuna ma'am. Today we are discussing a very sensitive topic, which is health rights of transgender people. As rightly pointed by sir and ma'am, that they face a lot of problems. Continuing with that, I start with saying that what they want from us. They want us that we treat them like everyone. We treat them like humans. We don't treat them like they're not humans. So first thing is the need of the time is that we have to sensitize. And this sensitization should start at the school level, at the elementary level, where we have to sensitize our kids about these people, because today's generation is tomorrow's youth and they are tomorrow's professionals. So it has to be started at the school. It is very well said that it is not the ailment that causes death. Ailment never causes your death, but lack of quality health care will cause death. Some months ago, I got through a news article where there was a report that there was a transgender person who met with an accident. I will not disclose the details because of the privacy issues. And the doctors could not decide whether to take him to this person to a male ward or female ward, and that person died. We all talk about good health, but we fail to understand that good health is not about just giving balanced diet, not only about just exercising in a healthy atmosphere. It also depends on quality of healthcare services that we are giving to the people. According to World Health Organization, the biggest challenge the mankind today is facing is to provide good quality healthcare services across the world. It is the vision of the WHO, World Health Organization, to provide good quality healthcare services to all in the 21st century, irrespective of geographical area, social and other constraints. But this vision is somewhat difficult due to increasing population on one hand and increasing burden of old and new diseases on the other hand. As we know that we faced a pandemic, COVID-19, and it became more difficult to provide quality healthcare services to all, including transgender person. Now, when the government has to make a law, they have to enact a law for the transgender people, when we have Article 21, which gives right to health to all. Article 21 does not discriminate. It says that it is for all, but still we have to enact a law. That means there is problem. Section 15 of this act talks about health facilities, and it mandates that the government should ensure that medical facilities should be given to transgender people. There should not be any discrimination in healthcare services in managing the government, and it is the duty of the government to ensure medical facilities and address health problems of the transgender people. But this is a sorry state of affairs that despite the directions of Honorable Supreme Court, the enactment that we have, still these people are struggling to have access to good quality health services. Still they face discrimination, which is based on gender identity. They still have inaccess to public health facilities. So today, first we will discuss what, though these problems are discussed by Harshita ma'am and sir, but again, I'll be discussing these problems which are faced by the people of their community. To start with, first problem they're facing is increased case of HIV and sexually transmitted disease. They are more common among them because adequate knowledge is not given to them. They, because of the lack of resources, they do not follow hygiene practices, and they lack access to healthcare services. According to a survey, HIV infections are high among these people. Let's say that if national HIV rate is 0.3% according to a report, it is 20 times higher in trans people, which is around 8.2%. Now, what we can do, the local authorities need to ensure that the health and social programs are taking care of these sexually transmitted disease by giving them adequate knowledge and resources. Secondly, as we've already discussed, they're also facing mental health problems. They suffer from a lot of psychiatric disorders, alcohol abuse, depression, depressive spectrums, because they face discrimination right from their birth. They are not supported by their family. They don't have house to live in, which they are not accepted by the society. This also leads to increased cases of suicide among transgender people. Apart from these problems, there are also problems of excessive use of tobacco, excessive drug abuse, alcohol abuse. They also face violence and victimize. We can divide these violence and victimization into different profiles, like low victimization. They face high verbal police victimization, moderate victimization, high verbal physical police victimization, moderate to high victimization, where along with uh, abuse, they are also sexually exploited. With that, they don't have homes to live in. As sir pointed out that they are homeless. Yes, they are homeless. Apart from all these things, one thing they face majorly is transphobia. People show hatred towards them. They fear from them that they may be kidnappers of children. People are intolerant towards them, discriminative towards them. They face harassment, threats of violence just because they don't have sexual orientation which is socially accepted. Now, when we talk about transphobia, that can be manifested to them in different ways. They face physical attacks, negative media representation sometimes. Sometimes we see movies where people from these communities are shown as criminals, which again help people to perceive that transgenders are only criminals. Now, let's coming back to the law. We have section 15, which gives which makes it mandatory for the government to give a lot of facilities to them. But despite these laws, I'm reiterating it again, that they face lack of healthcare services, because we have to understand that medical professionals are also part of our society. They're also taught from childhood that they are different people, and they also are responsible for transphobia. They also have hatred for these transgender people, to an extent that they will ask, whether private or public hospitals, they will ask these people to come during morning hours, early morning hours, or late evening hours. They will be asked a lot of private questions by the medical staff, which they are not comfortable in answering. They will be abused by the other patients present in the hospital. And sometimes when you talk to these transgender people, they say getting a treatment is like a curse for us. Why it is a curse for us? Because sometimes the medical professionals, they don't even want to touch them. They don't even want to feel the pulse of them. So it is high time that we sensitize the doctors as well. We include in their medical curriculum that they are also human beings. They are not no other different from male and females. This is just their sexual orientation, which makes us different, which makes them different. Now, I have few suggestions which can be included. First is that we have to bring in a lot of welfare schemes. We have to educate them. We have to provide them with homes. We have to provide them with some skills that they don't have to beg on the roads. They can earn money for themselves. We also have to, if they are taking some therapy, we have to have free pre and post operative counseling for them, so that they know that they can face discrimination, but they don't have to be affected by all those discrimination. I would like to conclude again by saying that they are humans and they have the right to be treated as humans like we are treated by the society.
Thank you so much, Khushbu ma'am. Beautifully addressed, and you have touched upon various aspects of the healthcare avenues provided to the transgenders. Well, there is one word which is called as gender variance also that I would like to bring forward. Like the transgender healthcare, it is also called as the gender affirming care, which includes the prevention, diagnosis, and treatment of the physical and the mental conditions, as well as the sex reassignment therapies for the transgender individuals. It's important for them to understand and know that such things are available for them. So, questions implicated in the transgender healthcare would include gender variance. It includes sex reassignment therapy. There are health risks. Of course, it is there in treatment of any kind of a disease. And also that the transgender should understand that they have the access to healthcare in India and across the globe. So, gender variance, I would like to talk about. So, gender variance in the medical literature that we talk about, it talks about gender identity. It talks about expression or behavior that falls outside or culturally defined norms associated with a specific gender. So, for many, 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 many years, gender variance was seen by medicine as a pathology. So, the World Health Organization dysphoria as a mental disorder in the International Classification of Diseases until the year 2018. Gender dysphoria was also listed in the Diagnostic and Statistical Manual of the Mental Disorders of the American Psychiatric Association, where it was previously called transsexualism and gender identity disorder. So in 2018, ICD-11, it included the term gender incongruence as marked and persistent incongruence between an individual's experienced gender and the assigned sex. So, where gender variant behavior and preferences do not necessarily imply a medical diagnosis. So, however, the difference between the gender dysphoria and gender incongruence is not always clear in the medical literature. So, some of the studies they believe that treating gender variance as a medical condition has got negative effects on the health of the transgender people and claim that assumptions of coexisting psychiatric symptoms should be avoided. So, there are other studies which argue that the gender incongruence diagnosis may be important, even positive for the transgender people at the individual and at the social level. So, there are various ways of classifying or characterizing those who are either diagnosed or self-affirm as transgender individuals. So we need to understand through this webinar that as per the Transgenders Act of 2019, there are healthcare facilities available for the transgender people, and that the judgment of the year 2014, it recommended reservations also for the transgenders in the jobs and the educational institutions, and that their right to declare self-perceived gender identity without undergoing sex reassignment surgery. Nitin sir, would you like to add on to it?
Hello. So thanks, ma'am. So at this point, I would just want to mention a scheme, welfare scheme by the Ministry of Social Justice and Empowerment, known as the SMILE scheme, that is support for marginalized individuals for livelihood and enterprise. And as far as the health aspect is concerned, this particular scheme covers composite medical health for availing gender reaffirmation surgeries, be it like pre and post operative procedures as mentioned by Dr. Khushbu Malik ma'am, and even other healthcare facilities. So besides this particular composite medical health insurance or some sort of assistance to the transgender community, they have also set up Garima Grass in each state for providing shelter facility for abandoned and orphaned transgender persons, and even setting up a transgender protection cells in the entire country for providing quick redressal of offenses and crimes against transgender persons. So all these things are in some way or the other way related to the right to life, and even right to health is an important part of the right to life. I think the government and government agencies and the concerned institute like National Institute of Social Defense and the ministry is working in this direction, and hopefully with the suggestion from all the stakeholders, and as Khushbu ma'am has already suggested, and our other esteemed guest speakers like Iftikhar Ahmed Bazmi Saab and Madam Dr. Harshita ji. So, with your suggestions, hopefully we will be able to communicate our suggestions to the concerned ministry, and as already conveyed in the already pointed out at the outset, that the Ministry of Social Justice and Empowerment is the nodal ministry responsible for the monitoring and the maintenance of the transgender people community in India. So hopefully these suggestions are going to be taken up by the concerned ministry, and hopefully we are going to see some change in the as far as the health scenario is concerned. And as ma'am has already described the data related to the transgender people across the world, and the data, the findings were substantiated by the WHO. So there are alarming figures, no doubt, but hopefully with the cooperation of all, and in this line we have also observed a Zero Discrimination Day yesterday only, and as a part of the Zero Discrimination Day, the main in focus or the main idea of the Zero Discrimination Day was also to provide relief to the HIV/AIDS victims and as well as to the transgender communities, and to decriminalize certain provisions of the law that are going to target or that are going to make the life of the transgender community across the world more, we can say, painful or more distressing. So it has been, I think, it has been pointed out in the as per the data shared by the UN/AIDS that there are about 53 countries, even in today's world, that they are having some laws that they are going to criminalize the people, or they are going to prosecute transgender communities on the basis of some act. And even though in India we have with us earlier we have with us like Section 377, and post Navtej Singh Johar case, we have seen that the whole the Supreme Court has decriminalized that particular section. So slowly and steadily we are moving towards the things in a much more refined and in a much more better way. And as far as Dr. Smitra ma'am has pointed out that how these terminologies and how these identities are going to be identified, and they are defined in a more sensitive way. And as far as the definition of transgender persons in the act is concerned, it has attempted to include each and every person who is who has who has been identified with some variation, and who is not at all ascribing with the identity that has been given to him or her at birth. So an inclusive definition has been given, and hopefully with the cooperation of each and every stakeholder of the society, we will be able to make it more inclusive, and with this we will be able to make a more inclusive world. Thank you, ma'am.
Thank you so much, Dr. Nitin Sharma, sir, for that perspective. Well, everybody, as India assumes the presidency of G20 for 1 year, and as Dr. Nitin Sharma sir said, we got to make the world more inclusive, and by spreading this awareness on Transgenders Act 2019, we are trying to make the society more inclusive by contributing our bit to the society. Having said so, it's a proud privilege to have with us one person who's from the media, Mr. Sachin Kalra, Vice President and Deputy General Counsel, HT Media Limited. I know, Sachin sir, it is with great difficulty that you've joined us today. Time is of the essence, and I'm not taking any time between you and the audience. Over to you, Mr. Sachin Kalra, for your address.
Hi, Sumitra. Hi, everyone. Hi, the panelists also. I'm really sorry that I joined late. Some back-to-back meetings going on, but somehow my strength towards MIT is always to be on the part of that tile with the law students always. That's great to be with you guys always, and talking about multiple subjects. Really wonderful. There's really an interesting subject which has been chosen, and an interesting topic which has been chosen with the rights which is to be governed, and right as a right to a male, female, or a right to a transgender, it should be availed and it should be given to everyone. And as per my understanding, and as per my understanding to the topic which is talked about, this is really a good step which has come forward from the government of India, where they have come with the thought process of giving multiple rights to the transgender persons. Basically, it may be, if you go to the law which says about it, should be not only health sector, it says about multiple things which should be provided: right to movement, right to public facilities, right to employment, education, rental properties, and all so on and so forth. So that's basically a thought process which gives a equilibrium or equity, or we can say a request to the transgender persons, basically, that they could be also be treated equally, and the equality should be governed in India. The right to equality is one of the fundamental rights which is governed the Constitution of India, and it's embedded. Basically, it's a DNA of each and every citizen of India, which comes to with the privileges and some restrictions which are there. So far, what I could gather basically with this movement of health and giving facilities to transgender on health side, it's going to give up facilities in the public basically, which they're lacking till now. With some schemes coming up with from the government of India to give them opportunity to have surgeries, therapies, medical curriculum, some separate HIV surveillance centers, and so on and so forth. So overall, when we give a thought process on this thought process, if I give you a background, that Niti Ayog looked into this, National Human Rights Commissions looked into it, and then they came up with the prospect how we can build up the framework together. And in case there's some issues on that, then this law also speaks about offenses and penalties which can come up. So as a person from this industry also, my voice, which is always there, is just that yes, equality is must to the people, and this is how it should be built in. And it's not only in India, it's also in India also, which this law prevails, and there are multiple countries which has a clear thought process on this, and which has been adopted by our country also now. That's the basic part which I may see. And the number of the section which is minority right now and how it is growing, we will also see that with the structure of frame that has developed day by day and continuously developing right now. So not much to speak on the subject right now, and just a thought process on to every one of you that equal should be treated equal and every gentleman should be treated equally. That's a thought process of mine, and accordingly you guys and everyone should look into it at better opportunities to everyone and give them a respect to the on the ground, that how better we can procure. And I think government will come up with multiple schemes along with multiple centers, multiple health hospitals on the part with number of facilities to be given on a repeat basis. That's good to us, and that minority should come into majority. That is also a requirement of day. That's from my side. Thank you. Not much of, because I have multiple meetings back to back packed up. Somehow can't give much of time today. There's another meeting planned at 4:30. So sorry, guys.
Thank you so much, Sachinji. I know you hold such a prestigious position. You're the Vice President. Thank you so much for your presence. Well, everybody, as we talk about the health of the transgenders, there is something which I wanted to make everybody aware about. Well, that is the hormone replacement therapy, which is primarily concerned with alleviating gender dysphoria, which I just talked about in transgender people. So trans women are usually treated with the estrogen and complementary anti-androgenic therapy. So this therapy induces different kind of changes, and when it is a trans man, then the therapy is different. Then there is a induction of a different hormone. So access to hormone replacement therapy has been shown to improve the quality of the life of the people in the female to male community when compared to female to male people who do not have access to hormone replacement therapy. So why I wanted to tell you this, because we need to know about these terminologies for transgender people as much as we know for male or a female in this culturally diverse society. Well, everybody, it's time now for question and answers. So we have with us Advocate Iftikhar Basmi, we have with us Dr. Harshita Singh, we have with us Dr. Khushbu Malik, and we also have with us in the attendee list, we have so many professors here and many students who joined us from different parts of the country. So I'll now request all of you to ask your questions from the panelists. There is one question which I have. This question is for Dr. Khushbu Malik. Dr. Khushbu Malik, so do you think, have you ever met a trans male or a trans female, and have you ever seen that they have been to the hospitals and they are standing in that line of the treatment? Dr. Khushbu Malik.
Yes, ma'am. See, I have met transgender people, but I have because my PhD thesis on health area only, I have visited so many hospitals, but I have never found these people in the hospitals, whether public or private. But yes, I have found them on roads, begging. That's it. Not in the hospitals. The thing is that they fear from, I have talked to many people. I'll share a personal incident with you all here. I will not name the university, I will not name the professor, I will not name anyone. I wanted to do a research project on transgender people, empirical research, and one of the professors asked me, being a girl, will you go in their areas? Will you talk to them? I said yes. So we have to, this is what I realized, that we have to change the perception of people towards them. We have to make them realize that they are human beings. And one more thing I would like to add is that we have to create awareness among the transgender people. We have to make them understand what their rights are, what schemes are. We have the ministry, the government launches a lot of schemes which they are unaware of. So we have to make them comfortable so that they can access these services and we can make these laws meaningful.
Yes, ma'am, very well answered that. So what is primarily important is the individuality and identity in grant of self-respect. So whether in treatment of any physical or a mental disease, what we want is that the self-respect is not compromised with. That as a transgender person, you get all the rights and all the healthcare facilities that any citizen of the country does get. Thank you, ma'am, for answering that question. Well, we are very happy that there are students and faculty members who joined us from Dogra Law College, Jammu. Thank you, Dr. Afia, ma'am, and other students for joining us. They have joined us right from the first webinar, from the inaugural session. Thank you so much. Well, now this question goes to Advocate Iftikhar Bazmi. Advocate Bazmi, as you said that you also wanted to bring some transgender people on the screen. So we would like to know what has been your experience as an advocate. Were you ever able to provide them with healthcare facilities, especially in the area where you are in? Do you think the people there are sensitized enough to provide healthcare facilities to the transgender persons? Over to you.
Hello.
Yes, so we can see you.
Yes, am I audible?
Of course, yes.
Interaction with the transgenders. I have from they have just come here to earn their livelihoods, and those who are from the native place, they are also in a vulnerable conditions because the people, they are not helping them, the government is not helping them, there is not any scheme on the ground level, so that we have to give them some financial assistance or moral assistance, nothing. Even I have approached to the district magistrate, who is a collector of the district, just to give them some financial assistance, and if we have some place to give them for residential purpose also. But we did not succeed anyhow. And even 10 days before, we have a meeting with the doctors, chief medical officer, and the superintendent, along with the deputy commissioner, that we must have some special ward for at least 5 to 10 beds for the transgenders if they have some problem, because we have a good numbers of transgenders here in Poonch city also. And if you see in Jammu, we have in thousands. So, but there is not a special, place for them in any hospital, in any other institutions. But if we recognize them, if we really identify them as a, as part with the society, we have to recognize them. There should be a special place everywhere for the transgender, so that they should come at par with us. And this is what I have seen. They have miserable life, they have not a good health conditions, and we have to give them a financial support, moral support, and other supports also. But for that, we need to raise the slogans, and I have to ask each and everyone who is there on the Zoom that whenever you see some of the transgenders, you have to give them at least you have to give them a respect. They should feel that we are a part of this society.
Yes, thank you, sir, for answering that. Well, everybody and all the panelists up here, there is one point, which is very, very at the core of the transgender persons, and that is violence. So there are heightened levels of violence and abuse that transgender people experience, and that results in the unique adverse effects on the body and the mental health. What a lay person would know about a transgender person more is that they suffer more from the mental health than the physical health. So, what would the panelists like to comment on that? Dr. Khushbu.
Ma'am, I agree with you that yes, they face abuse, both mental, physical. The physical can be manifested, but the mental agony what they face, that is not visible to us by our eyes, but that has a lot of trauma to an extent that they have suicidal tendencies. Can we just, we have to relate it to them that once a child is born in a family, the family neglects the child. They are beaten by the family to change their identity. They are thrown out of their houses so that they can force them to change their identity. They are not supported by any of the relatives. They don't have any friends. They're homeless. They're staying in some slums in their community. They don't have any skills. They don't have any education. So they go through a lot of mental trauma. So, and to an extent that they are susceptible to suicides from the birth. They have tendencies and they commit suicides. So we have to understand that we don't have to show sympathy to them. They don't need our sympathy. They need our empathy, that they are humans and they demand self-respect so that they don't face such kind of mental problems. And it is for the medical fraternity also, the medical staff, they have to be polite towards them. They have to be gender neutral. They have to treat them as a patient, not as a transgender coming to their hospital. They are a human being, and have to perceive them as a human being. So, and we have to give special training to these medical officers and the staff how we should treat them with empathy so that they don't face any kind of issues. For example, I sometimes have talked to these people. They tell me that when they visit a hospital, they are asked questions about their sexual life. They're asked questions about their genitals. Even the patient asks such questions. They should be asked questions which are pertaining to their ailment only and not any other questions.
Yes, ma'am, very well answered, and I totally agree. There is one more dimension and perspective to add to it. Well, so everything is based upon the age which we are in. So even a transgender person would have been a child once, then an adolescent, then an adult, and then the elderly and the aging. So transgender older adults, they encounter challenges in the access and the quality of the care received in the healthcare systems and the nursing homes differently as compared to the younger transgenders. So do you think, esteemed panelists up here, do you think that the elderly gender, do you think they require special clinics or do you think they require special healthcare system? Dr. Harshita Singh, would you like to take that? Advocate Bazmi, can you take up that question?
Yeah, yes, Dr. Sumita, this is a very important thing to be discussed here. I have seen even, if you see, because this is a natural thing and this is a universal truth also. Also, and I have seen in Jammu, the transgenders who believe to be, themselves as a female, they look very pretty, very beautiful, and the people, they are harassing them. They are not treating them as a normal girl. Similarly, as a boy transgender, if he's looking handsome, they are also being harassed. And this is the need of the time that we need to recognize them. And I've seen one of the transgenders 5 to 6 months before, I think she was bleeding and I have seen the clouds full of the blood. And I just, went close to her and I just asked her, Do you know that you are bleeding and your blood, this cloth is full of uh, this blood? She told me this is not, at least important for us, because the people, they, you know, never just feel as if they are at par with the girls. If it is bleeding, they don't care for us. But ultimately, we need to recognize them. I, have a sympathy. I take her at the side and I ask her just to change your dresses. If we have a sympathy, if we have a women at our home, we have our mothers, we have our kids, we have our sisters. If we treat them as a human being, why should not we treat them, these transgenders, at par with our family members? But it is not like that. As Dr. Harshita, she was rightly saying that if there is a patient is going to the hospital, he should be treated as a patient, not as a transgender. If we think he or she is a transgender, we will never give them a proper treatment. In the society, if we see someone is having a problem, we need to think that he is our family member, is a part of the society. Then we will give them a proper justice and everything. But until and unless we will not recognize them in the society, we will not be delivering justice to them. This is what actually I mean to say to everyone. Good with whatever we
Thank you, ma'am. So there is another question by the student. So I think the question is from Dr. Khushbu Malik, ma'am. So, ma'am, what do you think about the counseling aspect of this particular legislation? As far as the role of educational institutions vis-a-vis the counseling provided by the teachers, since this Transgender Act is also relatable to the psychosocial well-being. In other words, as you earlier pointed out that no doubt, as far as the proper or the general healthcare facilities are concerned, the situation is very worrisome. But at the same time, you stated that as far as the mental health care of the transgender person is concerned, it is already lying at the intersectionality of vulnerability. So they are much more vulnerable than the transgenders who are we can say affected with the general ailments. So what roles then teachers can play for the in terms of as a counselor for the students who are having some doubts or who are having some sort of confusion or suspicion, or who are suffering from something like this that is more or less related to their psychosocial well-being, in understanding or in understanding the general spectrum of the different categories of gender, or as the ma'am has earlier told the different terminology related to gender variance, then and to gender congruence, I think. And even though, as you earlier pointed out, the new aspects related to the transphobia. So what role the teachers can play in this aspect, ma'am? Please.
Sir, you asked a very good question that what teachers' role play. See, teachers, starting from our nursery class to our primary education, to our secondary education, graduation, post-graduation, or your PhD degree, teachers play a very important role in facing the character of a child, because they are the one who tells us, who frames our personality, I should say. That a teacher plays a very important role in improving or enhancing the personality of a child. So when the teachers, I feel the teachers never discuss these topics in the class. They're not comfortable in discussing these topics in the class. We are society. Every individual, every professional, we are the society, and society in turn back gives this to us. So from a grassroots level, if we start discussing these things openly with our students, that transgender is just a self-perceived identity. They are human beings. It has nothing to do, this is just a sexual orientation. So if we discuss these things openly with the students, then I think, because these students are the youths and they are the society, and then I feel that they will not be judgmental. For example, if a student has learned about a transgender and now tomorrow he or she is a doctor, I feel that he or she will not be judgmental in treating that person. Same applies to every profession, that we have to stop being judgmental about this class of people. We don't need separate laws for them. Why doesn't need of separate laws for them when they are human beings? What laws are applicable to us, they should be applicable to them as well. We should treat them equally, and we should respect our constitution by treating them equally.
Yeah, very well answered that, ma'am. So it becomes very imperative for all of us to understand that the transgender and the gender diverse individuals, they face harassment, they face discrimination and rejection in the society. Well, lack of awareness, knowledge, and sensitivity, as well as bias from the healthcare professionals, leads to inadequate access or underuse and inequities within the healthcare system for the transgender patients. And having said so, it becomes very imperative for all of us to understand that we should now move ahead and do something to go ahead to make the people, to make the transgender people, make them aware about their health rights. So, Advocate Basmi, what do you think the students should come up in the society and do to take care about the health rights of the transgender persons, especially in the sensitive areas in which you are in? How would you promote the youngsters to do something for the transgender people?
Thank you, Dr. Smitra. This is a very important question. You know, if we the fields, irrespective of what they are actually doing, but as far as the works with the transgender is concerned, we are feeling reluctant just go inside the slum areas where the transgenders are residing. If you see just where I'm sitting, just from 100 meters away from me, I'm just looking the slum areas where these transgenders are residing. It is very, if I'm speaking to you, but I'm just looking at the huts where they people are residing, you will see they are living in a miserable condition. We are going to the poor people, we are going to the downtrodden people, we are going to the, on the LOCs, we are going to the victims who are the victims of the cross, firings, landmines, but we have never visited the transgenders. Why? Is it a social stigma if we go? One thing we need to understand, I just directly speak to the students. Don't never think if you speak to the transgender, don't think the people say you are a gay, you are a lesbian, you are a homo, because this is a social stigma what we are facing in the society. Why we people are not speaking to the transgenders? Why? Have you ever, Cam, this thing in your mind that why people we are not speaking to these peoples? This has become a social stigma कि अगर आप किसी ट्रांसजेंडर के साथ किसी भी ऐसे बंदे के साथ बात करते हो तो people think that maybe he is having a same problem, that's why he is speaking to. If the girl is speaking to the transgender, उसको भी ये बोलेंगे शायद ये भी इसी community की है. No, but we have to keep away all such stigmas. We need to come to the society, to the slum areas, irrespective of your all such things. If we people will not come on the front, how we people can help these peoples? हमें इस चीज से बाहर आना है. We need to shun away all such stigmas. हमें भी, I have been asked by my friends, are you a gay, are you a lesbian, are you a homo, are you a transgender? But this is not, if people say आप अगर बोलते हैं तो आप क्या transgender हो जाओगे? If you are not, why you think so? You have to go, you have to sit with them. आप उनके पास जाइए, आप उनकी प्रॉब्लम को समझिए. When we are going to the people who are having a age problem, here having the different people, जहां पे आपको communicable diseases का खतरा है, जहां पे मरने का आपको खतरा है, where there we are going. हम AIDS patient के साथ, पीड़ित के साथ बात कर रहे हैं, हमें इस चीज का डर नहीं है, we are going to die. But एक transgender जो आपको कुछ भी नहीं, आपको दुआएं दे सकता है, गुड विशेस दे सकता है, आप उसके साथ बात करोगे, he will be so happy. But we people are ready to go and sit with them. The people who really wants to work in the slum areas where the transgenders are living, especially to the students who are over there in the Zoom. I ask you all, respectfully, I just tell you everyone, just to come forward, recognize, identify the area where you want to work. If the people are in a slum area, if they are the transgender, go sit with them, identify their problem, and then rule out who is the right person. Where you go, ask them to take this problem seriously, so that they will come from this problem. So we need to be very bold. We should not be having a like thinking that this is a stigma, and if you think, then we will not be able to do such type of social works.
Yeah, very well taken that, Advocate Basmi. So here I would like to add on that, everybody faces certain health risk, but there are certain specific health concerns that transgender and the gender diverse people need to be aware of. Like some of the health concerns may be due to an experience which is called as a gender minority stress, which can include the negative attitudes and disapproval towards the transgender and the gender diverse people, and this is sometimes called as social stigma, which we all know. Another thing is discrimination, abuse, harassment, neglect, rejection, or unfair treatment of the transgender. Then turning the negative attitudes or behaviors of others into the negative attitudes and thoughts about oneself. This is called as internalized stigma. So we have to understand that whether it is social stigma or internalized stigma, we need to overcome that. Well, because of the word which I just used, the gender minority stress. So, because of the gender minority stress, the transgender people may be at a very, very high risk of emotional and psychological abuse, physical and sexual violence, sexually transmitted infections, substance misuse, mental health problems like depression, anxiety, and also thoughts of suicide. So there is one last question coming up. So after one last question, I will ask my co-convener of this webinar series to give some of his views. And the last question coming up is for both the panelists here. That why should we care about the healthcare of the transgender people? I know this question is very vague, but why should every citizen of the country know about the healthcare of a transgender person? Over to you, the panelists.
So should I answer this first?
Yes, I'll go first. Yeah.
Yeah, thank you very much. This is a very interesting thing. Why should we help? And why should we identify and recognize these people that they need some special, attention and all such things? I'm gonna tell you frankly, the people I'm here just to see. There are a lot of people who are connected with us. At least more than 50 people are there in the Zoom now. Let me just conclude. As a boy, as a male member, if we are crossing certain areas where you see the transgender who is very, very beautiful, without knowing the fact that this female is a transgender, definitely you will be attracted by that, transgender. But as soon as you come to know that she is not an ordinary woman or a female or a girl, so your brain give you some signal and you just simultaneously start thinking negative. And we need to control our brain that initially you were having a feeling for a normal girl, you should be having a same feeling for the transgender. This is just a simple example. Don't think that the people who you are interacting is abnormal. He or she is a normal. You have to give them equal respect. And if you think that fellow, that transgender is having some problem, you need to identify them and you need to take them to the hospital, you need to take them to the institutions, and you need to take them as a normal human being, as if you are taking your family member. Then we will be really doing some social work in the society. Otherwise, this will be a futile exercise and we are not doing something good in the society.
Right, Advocate Bazmi, it takes two to make a four. So most of the people are like trying, as well as like the society has largely been able to emulate the vision of this act, and know the people are going to be more sensitive toward this community. Reason being, there is a constant evolution of human rights jurisprudence, as well as the constant evolution of constitutional jurisprudence in India, and likely in Nalsa judgment, as already it has already been discussed. So most of the basic rights of this community has been discussed, be it health rights, be it education rights, be it the right to against discrimination, or the principle of adverse distinction, and numerous agencies were like established so that their rights shall not go unattended, unheeded, and they will be given due justice. And likewise, we can know see different states they are towing the line of this particular reform in the form of like providing transgender, or we can say that they are proposing, or they are likely to conduct transgender census in the country. So likewise, we are sitting in Noida, and it is no doubt it is a part of the NCR, but truly speaking, it is a part of the UP only. And UP is going to be the, I think, first state is likely to conduct the first ever transgender census in the country. So the by if you are going to initiate this proper exercise, you are going to include them in the census. It means that you are going to extend a number of other facilities, be it in the form of the schemes like Dr. Khushbu Malik ma'am has pointed out, like schemes in the form of assistance, medical assistance, or pre and post operative care. Though ministry has some schemes about this, has already demarcated some schemes, but time and again people used to say the amount is less, like they are giving 5 lakh amount, and even though in some cases 6 lakhs also. So though so the by the inclusion of the transgender community in the census, so the this particular the state of Uttar Pradesh is doing a novel type of experiment, and I think in the times to come, most of the states are going to also emulate this vision. And even though the social welfare ministry of the concerned state, Uttar Pradesh state, has also proposed to include, or we can say was proposed to provide a budget of 200 crore for the welfare of transgender people. So by providing them education facilities, developing their colonies, and with basic amenities, and rehabilitating elderly members of the community. Like as you were talking about the condition of the slums. So their colonies may be regularized, and as well as the condition of the elderly section who are like more vulnerable. Like Khushbu ma'am has earlier revealed that the plight of the transgender people having mental health issues are more vulnerable. Similarly, the children belonging to these communities are more vulnerable, as well as the elderly people are more vulnerable. So likewise, I think the reforms are going on, and surely with the help of all the stakeholders, with the help of esteemed speakers like you, we will be able to make some change. And Meti Legal Aid and Literacy Society is already working on this particular on this theme, and with the support of Chairman Sir, and with the support of our HOIs, and especially Professor Dr. Aditya Tomar Sir, we have been able to establish a separate and dedicated cell on this particular thing, so that in the times to come, as and when the new students are coming, they may see the purpose of this cell. And by this way only, as Khushbu Malik ma'am has said, that the role of the teacher in this particular aspect is very essential. So by that way only, we will be able to transmit or disseminate this information, not within a Meti Law School, but across India. So thank you so much, sir. Thank you, Bazmi sir, and thank you all the esteemed speakers.
So thank you, sir. So before we finally wind up, we have, let me just check the time. We have hardly 4 minutes in hand. So before we finally wind up with a vote of an official vote of thanks, there is something more to tell. That Amity Legal Aid and Literacy Committee is the biggest student committee in India. Right now, we have engaged more than 400 students of Amity Law School in this committee. Many of them are in this meeting, and many of them are attending as live on YouTube. So at gate number 2A of Amity University, Uttar Pradesh, Noida, we have our satellite office, which we call as Samadhan Kendra, and which is under the supervision of none other than our additional director and joint HOI, Professor Dr. Aditya Tomar, who is the person behind all the inspiration for Amity Legal Aid and Literacy Committee. It is under Sir's guidance and directions that Amity Legal Aid and Literacy Committee is trying to contribute its maximum to the society. Our founder president, Dr. Ashok K. Chauhan sir, has full confidence in us, in all the Amitians. He believes that every Amitian is an asset to the society and the world. So we have to work both, no, at three places, at the local level, at the global level, and also at the global level. Because at Amity, we believe in taking Amity to the world and bringing the world to Amity so that we can solve all the global problems. And it is pertinent to understand here that healthcare facilities is provided pan world. So there are different countries who offer specific healthcare facilities to the transgender persons. And by taking up the presidency of G20, I'm sure Honorable Prime Minister is trying to make the society more inclusive, and that there will be a time when we as Indians will be able to offer this healthcare facilities across the globe. So without taking much time, I'll request our Additional Director and Joint HOI, Professor Dr. Aditya Tomar sir, to speak in a few words, and then request Varuna ma'am to present the vote of thanks. Over to you, respected sir.
I just want to pay the regards to all the speakers, especially Iftikhar Ahmed Bazmi Sahab, who took a lot of pain due to the connectivity issue, technical issues, and due to you, Dr. Sumitra and Nitin, who just put lots of questions to Iftikhar Bazmi Sahab, Khushbu Malik, and our colleague Harshita ji. So thank you very much to all the speakers who spare the valuable time and just tried hard to align the student mindset towards the interest of especially about the social justice, especially about the transgender issue. So I would like to thanks to all. Start with Khushbu Malik, Bazmi Sahab, Nitin, Varuna, and especially you, Sumitra, and our colleague Harshita. So thank you all.
Thank you, sir. Your words are motivation for us every time, whenever you motivate us. On screen, off screen, yes. Well, everybody, let's try to look for rainbow in every crowd. It's because equality and liberty and freedom can only be fulfilled when each of us realize that the rights of the transgenders are same as ours. Having said so, I'll now request co-moderator Dr. Varuna Chakrabarti to present the vote of thanks.
Thank you so much, ma'am, for giving me such opportunity. Well, after this session, I can proudly say that right to health, as given under Article 21 of the Constitution of India, is not only a constitutional right, but a human right as well. This article cannot be even suspended during emergency. So it constitutes the basic structure of the Constitution, cannot be compromised at any cost. Therefore, it is important to look after the health of each and every individual of the society, irrespective of gender. Here, I take the opportunity to thank our founder president, Chairman Sir, Professor Dr. D.K. Bandopadhyay, our different HOIs, Professor Dr. Aditya Tomar Sir, Professor Dr. Shafali Raizada Ma'am, Professor Dr. A.T. Bhanu Sir, our esteemed guests for today, Advocate Bazmi Sir, Dr. Khushbu Malik Ma'am, Dr. Harshita Singh Ma'am, and Mr. Sachin Kalra Sir. And last but not the least, the Ministry of Social Justice and Empowerment, Government of India, and the organizing team. Thank you for conducting the event so successfully. Thank you.
Thank you, Varuna ma'am, for that beautiful word of thanks. Well, everybody, it's time to depart from this beautiful portal of Transgender Persons Act 2019. And I would again like to end this webinar with the quote that determines self-expression and which lies in individuality and identity and in the grant of self-respect to everybody. And that's one signature, and that is self-determined design. So one can define oneself with that self-respect, and that is the glorious form of individuality. Having said so, in the words of our Honorable Founder President, Dr. Ashok K. Chauhan, goodbye and God bless everybody. We'll meet next time in the next webinar. Stay tuned. Bye-bye and take care. Bye-bye, everybody. Munazir sir, we can close the session now. Bye, everybody. Take care.